Hello and welcome to Psych and Sex Sundays with Dr. Sonya Maya. That is me. This is a channel where we talk about all things spicy time, relationships, psychology. So if you like those types of videos, make sure to hit that like, subscribe, and turn on those bell notifications so you won't miss an upload. And today I want to talk about, is it normal for a vajayjay, a vulva, a labia area to feel swollen after sex? So I'm going to get into that. And at the end of the video, I'm going to talk about this particular idea where people seem to believe that a vagina gets loose after you have sex. Like the more sex you have, the more men that you sleep with or people that you sleep with that penetrate you, the more your vajayjay gets loose. And I'm going to talk about whether or not that's true at the end of the video. So make sure you stay tuned for that. So, is it normal to have a swollen labia or swollen feeling down there? Some people describe it as raw, and people, they're not like, baby, I like it raw. They're like the opposite. I don't like that raw feeling. Okay. And it's actually normal. It's actually pretty common. The reason this happens is because when you get aroused, a lot of blood flow goes to that area, as we know. And sometimes you might actually get quite aroused without lubricating, right? So more blood flow to that area, more likely there might be some discomfort afterwards, especially if there's a lot of friction. So if there's a lot of friction from the intercourse, like you're going really hard, you're really in the moment, right? Or your partner's, penetrating really hard, that kind of thing, you might not realize it because the pleasure is so pleasurable in the moment that it's kind of offsetting the pain in your brain. It might feel really good to have it hurt so good until afterwards, and then you're like, dang, did I just go on a 50-mile bike ride? Like, what's going on? It's like, no, you did go on a ride, honey, but not a bike ride. Also, sometimes there can be some tears or abrasions that can lead to this pain. This can also happen after masturbation too, not just sex, especially if you don't use enough lube. So one way to prevent this is going to be adding more lube, but honestly, sometimes when you add enough lube, it could still happen. Kind of hard to avoid. Sometimes you might actually not be aroused enough, and sometimes when you do get aroused, you don't lubricate enough, but other times you do, right? It really depends on the person, the time of the month, all of those things. So the more that you work on that foreplay, so that means like you're going to be taking more time to get aroused, maybe taking like 15, 20, 30 minutes of foreplay, kissing, touching to do all of that. When you take time to warm up the oven, you're more likely to have that adequate lubrication. So it's something to keep in mind. Another reason that you might actually have an irritation down there is due to vaginitis. This could be due to inflammation of the vagina, and this can be related to vaginitis, which is an inflammation due to infection. This leads to a lot of itching, burning, or discomfort during sex or after sex. It can also cause a bit of an odor. One type of irritation you might also experience is called bacterial vaginosis, or BV. This is very common. It's related to an imbalance in bacteria down there, and doctors can treat this very common condition. This often leads to a thin white or gray vaginal discharge with a fishy odor, especially after sex. And this is very common for women and vulva owners among childbearing age. Also important to keep in mind that you could be experiencing a yeast infection. A yeast infection is kind of like what it sounds like. There is an overgrowth of yeast down there. And this can be treated with a cream or a pill. It must be diagnosed though, so don't go using any of those over-the-counter medications until you talk to a medical professional like a doctor. In general, there could also be STIs involved, but a lot of the time when you're having irritation down there, it's not related to an STI. But it's important to keep in mind, so definitely get tested. I always talk about this. Not fun to talk about, but definitely true. Another reason you might have irritation and swelling down there might be due to an allergic reaction. You could be allergic to the lube that you're using, the condoms, the soaps, even the tampons, And of course, if there's an allergic reaction and you're having rough sex, then of course that could lead to some irritation. So it's all kind of trial and error and figuring out, like, is this a product that I just tried? Let's be more careful with that kind of thing. Maybe eliminate some products and just see what happens. But like I said before, if you're experiencing serious discomfort and your vagina feels swollen after sex and it's really uncomfortable to the point where you can't even really function or go to work, definitely seek medical advice. How to prevent, like I said, so using a different type of lube is going to be really important, right? You want to try lubes that are paraben or glycerin free. Sometimes it's good to also try condoms that don't have latex, just in case you have a latex irritation or a latex allergy. You want to use products that are hypoallergenic in terms of lubricants, condoms, and tampons. Another way to kind of get ahead of this is strengthening your pelvic floor. The more that you strengthen your pelvic floor, the less you're going to be vulnerable to rough sex, tears, that kind of thing. But let's say it already happened. I know we talked about prevention, but what about when it already happened, You want to take a break from sex, of course. Give yourself some time to heal. Another thing that you might want to try is compression. So you can use, there are genital pads that you can try. And sometimes they cost about like $40 to $60. Some people actually say that using Spanx or biker shorts can be helpful temporarily to add more compression and pressure to that area. There are also swell spots or female genital pads that you can try. And you want to also take a break from wearing tight clothing for a little bit. So you want to use loose clothing and loose underwear temporarily. But yeah, if you're having pain, discharge, or severe pain in general, definitely see a doctor for a diagnosis and medications. And in answer to the previous question that I was talking about earlier, no, having a lot of sex does not make your taco, your magic conch, loose.
Praise the magic conch!
The only things that actually make you loose are childbirth and aging. If you notice that over time you're noticing some looseness, or after childbirth, you can practice Kegels, pelvic floor exercises. If you strengthen your pelvic floor, you're going to be able to tighten that vaginal floor and that opening. You might want to start with 5-second Kegels and then move your way up to 10 and put it in your schedule. And you know, the cool thing about Kegels is you can do them anywhere. Plenty of resources online for figuring out how to do that. If you want a more in-depth video about how to strengthen your pelvic floor, let me know and I'm happy to make that. That's it for this video. I hope you liked this Psych and Sex Sundays upload by Dr. Sonya Maya. Don't forget to hit that like, hit that subscribe, and turn on bell notifications, and I will see you next week for another video. Bye.